Looks like everybody's jumping on. So good afternoon, everybody. Welcome to the end of day one. Since this is limited to 500 people, we're calling it the VIP session. We just figured that out. So my name is Ed Klima. I'm the managing director of the First Responders Center. With everybody today to recap day one is Dr. Gist and Chief Oates, who you've heard from earlier today. Before we kind of get into some discussions and some Q&A, I just want to again thank FEMA and the Assistance for Firefighter Grant Program for funding this initiative, as well as our gold sponsor, FirstNet, and our other sponsors, Cortico, Geisinger, and the National Fallen Firefighters Foundation. And also thank our advisory committee that's worked on this. Originally planned to do this back in the fall in person and then in the spring in person. And, here we are virtually, but just because of scheduling and local restrictions, we couldn't, make it happen in person. But the good thing is we're reaching more people this way. So Dr. Gist, Chief Oates, Frank Lido, and Patricia Watson and Vicki Taylor, who you'll hear from tomorrow, want to thank them for their continued support. And most importantly, because she's on here right now, we want to thank Lori Jacobs from the FRCE, who's really been the one working like crazy to put this together. I can just tell everybody here that doing a virtual conference is about 20 times more work than an in-person conference. So thanks, Lori, for all your help in the last couple months. So I thought, just for everybody, if you have a question, if you want to write it in the chat side on anything from today, we'll grab those and present those to John or Richard if you have a general question or if you have something specifically for one of them. But I thought I'd start with a couple comments and John and Richard, get your thoughts. I thought that in Chief Richardson's keynote this morning, he talked about the process of adapting well. And I'm curious from your guys' perspective is, how well do you think we really are adapting in the fire service? And, what do you think are the most concerning things going into the next 6 to 8 months still, if any, as it pertains to adaptation?
Well, one thing I think is important here is to remember that, as you've heard several times in several presentations today, this is about adaptation. Resilience is essentially a process of adapting. In terms of how the fire service did on this, it was tough out of the box. We had very little guidance. We couldn't get things that were very critical to us. Those organizations who were able to get in front of that curve still struggle to try to keep on top of getting things, anything from acquiring PPE to being able to get current guidance out to our personnel, and that it would change almost daily. And what we told you to do tomorrow or yesterday would be different than what we were going to tell you to do tomorrow. As that began to slow down and our systems caught up, I think for most of us, things started to get more reasonable. And in the end, and I'll defer to John on this because I know he has some very important thoughts on it, but the thing I noticed as an executive officer in a large organization is in the end of it, all of our systems of being able to both listen and communicate had to get better. And our intention is to make sure that we are able to use that going forward to be less reactive, even internally, about how we manage things, and begin to spend a lot more time anticipating and being able to work in real time. For example, in our organization, we, in the beginning, had sit-rep virtual meetings every single morning, where we went over what our standing was at that particular point, what our issues were for today, what we were going to do on those, and what information we'd need at the next sit-rep coming up tomorrow. That turned out to be a very useful process and not one that we just simply abandoned because we're no longer in a crisis mode. That element of communication, as several speakers noted, is very essential to everything that we do to try to both manage and respond. So I think we'll see improved communication. The second thing I think is going to make a big difference is just look at what we're doing right now. And we were overjoyed at the first one of these in Denver that we were able to get about 600 people together. We have 3 times that number of people signed up to watch these. And instead of taking out a week of their life to go somewhere, if they've got to go do something for an hour, they can come back and pick it up and still be part of the conversation. I think we've got a lot to learn about how we communicate. We lose a lot by, as I think Frank, I know, mentioned, as well as some others, we don't have that opportunity to talk to people and network and do things like that in the same in-person format we have. But I think most of us, what we're going to see going forward in training and education is a really good mix of learning how to hybridize these things, so that even when we do our next in-person symposium, I suspect it'll still have a virtual component to make sure that it is able to reach the largest number of folk. Getting this message out, as there are over the course of the next couple of days, just as there were today, some outstanding people who are going to be talking about very important things, people most of us would never get a chance to hear. And that hybridized method means that it's not just if you can get away for 4 days in one place, you'll be able to hear, for example, Admiral Flynn talk about the public health connection forever, in an online element. So I think that's a really big contribution to how we do things.
I think when you look at it, just back to the original kind of where the concept was, we did what we do because like we really didn't have any choice. It's like it's adapt or die. You could sit in the corner and huddle up and poop your pants and hope for tomorrow's going to be a better day, but that's just not going to work. We fire serviced it and said, okay, how are we going to find our way out of this mess? And for some of us some that had systems and support in place, it was an easier pathway. For people that struggled the day before COVID existed are going to struggle the day after COVID existed. But I think it's, if there's any organization that was wired to do it, it's the fire service, because essentially every mantle we have taken on has been with little preparation, certainly no extra money and no extra people. And, in the history of us as an entity, and I don't care if you go all the way back to early EMS, vehicle extrication, hazmat, confined space, terrorism, to now mobile integrated healthcare and vaccination. 2 days ago it wasn't on anybody's radar. Tomorrow you better be able to do it and do it at a high level. And it's something that the fire service is unfortunately gotten really good at. So I think some of it is we had no choice, but to be able to pull it off at a high level. I don't think any of us want to do it again, or certainly that frequently. I think I told somebody the other day I would have been happy to end my career without a pandemic, but we don't get to choose. So I think it's been an interesting exercise, but like everything else the fire service has done is, let's pivot and go, because we don't have an option, because there's a service delivery expectation in each one of our communities.
I know one thing that often happens in studying disasters over a half century here is that the role extension and role expansion that I spoke of in the brief introduction to Anthony's presentation, that role extension, role expansion does not tend to go away at the end of a pandemic or at the end of any crisis. You go out and you do things and they become a part of your relationship with your community. So for example, our presence in places like vaccination clinics, I think that may be something that we look at as a function of our role moving forward on a bunch of other things. Are we a resource that people could use for other kinds of public health encounters? We're there in their communities on a constant basis. And are things like that going to become a part of the way that we view our service to our city? Again, I suspect that it'll get a lot of thought, and it'll probably get built into the mission, because things that we reach out and do that create connections with our community don't tend to recede just because the crisis is over.
Yep. I think the other thing, follow up on Chief Richardson this morning is certainly some of his comments on leadership, and that was touched in a couple presentations. And you know, that's a topic certainly we'll get into detail later in the week. So I think particularly in Thursday. When, you know, Dr. Gist, you mentioned a couple things from Brian Flynn's presentation, and I think, you know, one of his slides in the beginning, you know, why do we feel so bad? And if you look at, you know, any one of those particular situations, they could be stressful for people, and you compound them and throw them all together this year for many folks. And it's not hard to see where, you know, on the good hand, on the good side, a number of people were able to cope with everything that was going on, but certainly understanding why many couldn't. And I think that the conversation about integrating stress management as a job skill, and you know, doing that early, and it you know, it'd be great if as a society we introduce that as a skill in the school, with school age kids, which is a broader discussion. But you know, maybe Chief Oates, talk a little bit about you know, our need and how we can you know, do that a little better in the fire service.
I think, you know, one way to do that is to literally start on day one. You know, you need to have that that conversation in day one or shortly thereafter in career fire service recruit schools, on family night in your volunteer fire station, in whatever the orientation and onboarding process is in your EMS organization, and then to walk the talk. I mean, you can't just say we care about you and we're worried about your behavioral health and your family and the whole, and the health and wellness of the whole employee or whole member. You actually have to go out and do it. I know a couple things that are going on here in Connecticut currently. The Fire Academy's Recruit Firefighter program, which serves the 40 or so career fire departments in the state, is the FRC's Stress First Aid program is a requirement. You know, it's a curriculum module to give people the skills for both self-care and buddy care on relative to stress first aid, and to get away from here's a 5-minute orientation to your EAP, to really kind of dive a little bit farther into it, and to give them, and there's another segment on tools for a healthy career that to help set the table for success, and what we do to plant enough seeds that some of these things that our generation of the fire service struggles with may not be quite as problematic for the next group coming forward.
I think people who are interested in seeing that further will get a great deal out of Dr. Watson's keynote tomorrow on stress first aid. Because one of the things she'll be addressing with the attendees is how stress first aid isn't some little program that's meant to be a Band-Aid on, you know, a bad day you had. It's actually something that's designed to be built into the fabric of the way the organization works and the way the firefighters relate to one another, not just for the big, the bad, and the ugly, but to try to support people on a daily basis as part of a logic model to help people get to the level of help they need in a quick and efficient way whenever the need arrives. And again, not, if you will, overreacting or over-responding, but being there for one another on a regular basis. The short story is this: after so many years of looking at the epidemiology of these things, the only thing that really predicts what shape either you or your organization is going to be in 2 years after a major crisis event is what shape you were in 2 weeks before. So the issue is to stay healthy and stay connected always. So when the need arises, those connections are there, that strength is there, those skills are there. And that's what SFA is designed to do.
Yeah, good points. And like you said, we'll have more conversations about stress first aid tomorrow. I thought, shifting gears a little bit to Chief Oates, to your presentation, I thought there was something interesting that came up from Drew Kane from FDNY as it relates to AA and you know, folks when meetings were canceled and they couldn't go to their in-person meetings. And I thought there was a real interesting dynamic there, because we've always said, and as it relates to mental health and access to telemedicine, that it would be a good thing. And certainly I think there will be many good elements that transcend from the last couple of months. But I don't think I think at the same time, it comes with some drawbacks. And you kind of saw that with Drew's comments today of, folks that were used to going for in-person support, whether it's AA or simply counseling services, and not being able to do that was not well received. And then, I thought it was interesting that they found that people that had not, participated before did find the virtual component helpful. So maybe to talk a little bit about I know we're going to get into that more this week too, but there's an interesting dynamic there, I think, as it relates to, telemedicine and some lessons learned.
I think it can be, we look at things that we want to keep and things that we'd be perfectly happy never to see again. And I think telemedicine is one of those frontiers that we've only scratched the surface on how beneficial that can be from a fire service behavioral health perspective. Because you're right, it allows you to maintain connectedness in times when, and again, it could be natural disaster, it could be a blizzard, it could be my shift schedule changed and I can't see my clinician, but I can hop on, I can hop on my smartphone with a couple minutes and have that conversation. I look at it also as a tremendous tool to reduce stigmatization, because now you're really truly in a sphere where nobody has to know. You can be in your bunk room in the firehouse, or outside sitting on the front porch of your house, and having that telemedicine type of conversation where it's only you and that individual, and nobody's going to know, nobody's going to see your truck parked in front of the doctor's office, or whatever those things look like. It's truly, and I think there's some programs in Texas and South Carolina that have proven the value. And for those of us in the rest of the country that are just walking down that path now, I think it'll be the next big frontier of change for us to track those resources, develop those resources, and make them easily accessible where members can grab onto that wherever they are, whatever state they're in, to be able to use things like telemedicine and some of the other programs to be able to get themselves help in a way that's quick, that's functional, that meets the needs, and helps support the in-person clinician opportunity.
Pretty much like some of the things we were saying about other parts of learning our way through the pandemic. We've learned an awfully lot about telehealth options in behavioral health, which were a very, very small portion of how we did things a year ago. But the things that are maybe the most important to kind of grasp at this point, because it's very rudimentary stuff. I mean, we're just kind of now processing our way through the information. That one of the things that you have to consider is, what is the nature of the problem you're bringing forward? Secondly, what is the severity of the problem that you're bringing forward? And third, what is the history and expectation of it? So basically, telehealth and behavioral health has been better received than almost anywhere else, but that is specifically for the things that are more in the problem of living kind of basis. And to compare it to telehealth in general medicine, telehealth is real good to get your medicine check from your doctor in a convenient sort of way, or get a response to an easily diagnosed basic thing. It's not going to help you if you've been taken severely ill. For example, telehealth is no way to try to deal with an ongoing myocardial infarction. You got to have hands-on, there's stuff you got to do. And secondly, for things that are new kind of new introductions to the healthcare equation, people who begin that way find it very useful and easy. And third, if what you're doing is to try to communicate certain skills like cognitive behavior therapy puts across in a lot of situations for those who are familiar with it, that works very well by telehealth. For the things where support and mutual contact are the essence of it, not so much, because that sense of personal proximity and what we call propinquity, that can't really be simulated in a technological environment as effectively at all as it can be by people having the opportunity to be present with one another in a room. So just remember, we're learning our way through it, but the important thing, I think, from the fire service side of the equation is our big struggle has always been to try to get the expertise that you can get from people like Frank Lito and Drew Kane in FDNY to the volunteer firefighter somewhere in South Dakota who doesn't have that kind of skill within miles, and certainly not that kind of cultural sensitivity to the fire service. Telehealth allows us a way to distribute the skills of those well-trained, culturally competent therapists to everybody in the industry who needs them, rather than having them more or less restrained to those places that are fortunate enough and funded enough to be able to put up a specialty clinic.
Well, Dr. Chuck, I saw your question there to Dr. Mancini, who's not on, but we'll get that question to him and email that to you directly. So we'll handle that. You know, we have about 10 minutes left. Does anybody have any, you know, particular questions, you know, related to anything from today? Because the one thing I've learned about CVent is they have a hard stop. Well, let's keep going a little bit on discussion. So we have a couple other presentations or a number of presentations this week, but you know, Chief Oates, what are some of the topics you're most looking forward to discussing the next couple of days?
And it's tough to narrow it down, but I think there's a couple really important things. I think for people that have used stress first aid as a tool, I think the presentation on the efficacy and the value of that and what it's shown in places is helpful. At the same time, the presentation that Dr. Hollenbeck's going to do on, well, what's next? Because there's a whole lot more to building a behavioral health program in your fire department than stress first aid. Jason Bresler's program is always something that you can gain something from, just because his depth of understanding from a leadership perspective and a behavioral perspective of how firefighters are wired. And but there's really, I mean, there's no duds in this program. You can sit and just kind of soak in everything from everybody from every presentation.
Richard, we didn't, you know, we really didn't touch a whole lot on Dr. Mancini's presentation, which was right before this, and you certainly were a part of that as well. You know, I think it'll be interesting to see how things play out. Certainly some of his research as it related to, you know, the hurricanes, and then early, you know, meta-analysis of things related to COVID. I think it's, you know, it's obviously going to be interesting how things play out long term with that. I wonder if you had any other thoughts on that part of his presentation.
I think the thing that's really important to get out of that, and it continued through all the stuff that you heard over the course of the day, is we tend to put a lot of our focus on the things that break, and it's important that we do. But on the other hand, when we look in the long term in the public health picture, the thing that is always more intriguing about these kinds of, especially large scale disasters, is what they bring out in people and what they take away from it. I know Brian Flynn and I go back a long way. And we both independently kind of hinted at, Brian more directly than I, at something fairly important about doing this work. And that is, it fundamentally changes who you are. And the thing that for researchers like us, the thing that changes who you are is not the amount of tragedy you see, but the amount of resilience. Because it teaches you lessons about how people really do navigate their lives and the difficulties they see. So many times we come in and out of them at the worst possible moment, and we only see the damage and we don't see the recovery. And yet, you know, I would echo what Brian had said, that, you know, working in this, the reason I stayed 23 years beyond my 10-month sabbatical is that it makes you a much more, I think, a better human, a much more appreciative person. It, you know, my kids were young when I started this. It made me have a tremendously better father, to be able to look at how people manage to pull themselves through these circumstances and to realize that we're all just one moment away from something terribly disruptive, and much of that is governed by chance. When you understand that, you go through life considering that in everything you do. The first year I was with the fire department was the worst year in our history for residential fire deaths of kids under 9. It was at that point the leading cause of accidental pediatric death in Kansas City for 2-3 years of residential fires. When your own kids are small and you're having to deliver that news to people over and over again, the one thing it leaves you with remembering is whatever you're about to say to your kid may be the last thing they ever hear from you. And maybe the last thing you ever get to tell them. So I don't care how mad you are at the moment. Think ahead. Think ahead. And the other thing it frankly taught, a series of things I gave in a parting talk to a recruit class once about, hey, you guys won the lottery. You're in the best damn job in the world. You're going to get paid a decent salary, working 9 days a month to be Boy Scouts. And all we ask of you are 4 things. 1, show up. And not just be there on the job every day, but be present, be mindful, be engaged with everybody you deal with. No matter if it's your 12th call of the day and you're worn to a frazzle, it is still that person's most important moment. And for them, you're it. You're Kansas City. Secondly, be nice. Come on, what's it hurt you? It's our product is trust, and people trust us because we show up and we give a damn about what's going on in their life, and we do our best to try. If we can't make it any better, at least we try to keep it from getting any worse. The third thing, play safe. I mean, most of the stuff that gets us in trouble is stuff we do to ourselves. So that means being ready, being fit mentally and physically every day to take on what your job's going to ask of you. And the fourth thing, the one we miss so often, go home. At the end of the day, go have a life. Leave all this behind you. It'll be back in 2 days when you come back to the job. But in order to keep your own sanity, go home, have a life, be a person, and then come back and be a firefighter again on your next assigned shift. But the very, very basics of things like that, in response to an earlier question, those are the things we need to tell kids from day one. That to take care of yourself, you're going to have to think of it as a big part of your job. If you want to avoid a heart attack on the fire ground at 50, think about what you're splashing onto your plate at Cook Shack for noon. That's what's going to come back and bite you. If you want to have that social support on the day the world falls apart for you, you better be cultivating it all the time leading up to it. So you've got something to fall back on. You have people to lean on. In our studies of suicide in this industry, the one thing we've learned so far that's most interesting is that we actually have a protective factor as long as we're on the job. And that's that social connectedness the job gives you. Where things get risky is one way or another, when you're no longer there and you lose that support system, everything it was able to help you deal with can come crashing back at you. So we need to learn something from the military about how it's not just supporting people from the day they sign on to the day that they walk off. It's about taking care of them and their life with their families and their well-being all the way through. That we're committed to you throughout your life, and we're going to take care of you in exchange for the service you gave. We got to get better about that, and we have the capacity. For those who are interested in that, that's what leads off Wednesday's presentation is Kurt West from the Uniformed Services University, the Military Med School, talking about how they build clinicians for the military and what their philosophy of practicing medicine is. And that's a big part of it, is we're taking care of you and those around you all the way through this ride.
No, that's going to be an exciting conversation. And to jump in real quick, because we have about a minute left. So I want to thank you, Dr. Gist, for your comments, and Chief Oates. Thank everybody for jumping on today. Certainly, if questions come to mind later on today for about anything, feel free to chat with us tomorrow, and we'll include it in tomorrow's conversation. But we hope everybody enjoyed today and look forward to seeing everyone tomorrow. Thanks, guys.